Epidemiologist Professor Salim Abdul Karim says vaccination should be a requirement for public transport use. Just last month, the health minister had repealed COVID-19 regulations, including the requirement that people leaving and coming to the country must produce full vaccination certificates. Now, to discuss this even further, we're joined by Professor Benjamin Smart from the Africa Centre for Epidemiology and Philosophy of Science at the University of Johannesburg. Professor Smart, thank you for your time and good morning to you. What's your view when it comes to vaccinations, particularly for those in public transport? We know that oftentimes, they are full to capacity, taxis, buses. But when it comes to vaccination, what do you think should be the way forward?
Good morning. Good morning to your viewers. Professor Karim is obviously absolutely right that we need to increase the number of vaccinations in the country. We have a huge vaccination hesitancy issue in South Africa. And of course, if you implement what would essentially be a vaccine mandate to certain members of the population, that would increase our numbers and ultimately be a good thing for public health. Whilst the COVID numbers are quite low at the moment, there is nothing stopping another wave and another variant that might be more dangerous. And increasing the number of vaccinations, the number of people vaccinated in the country would definitely be a good thing. For me, the issue is more a bioethical one. You see, if you make it essential for those using public transport to be vaccinated, you're essentially putting in a vaccine mandate on the poor that doesn't apply to the wealthy. And that's a serious bioethical problem. Yeah, I mean, government have committed again and again to not enforcing a vaccine mandate sort of globally to everyone in the country. And yet, if you're faced with a choice between traveling to work and getting vaccinated, it's not a real choice. You have to travel to work to feed your family. And so you're forced into a vaccination that you may not want.
Yeah.
Now, the vaccines are safe, they're effective. Everyone should get them. You all have, I believe that everyone has a duty to vaccinate to protect themselves, their families and their communities. I believe everyone should get vaccinated. It's absolutely essential. But to have a vaccine mandate that applies only to the poor is seriously ethically problematic.
And that was going to be my next question, Prof, to say, will this not be met with outrage? As you've rightly, put it, it seems like it's more forced because obviously people have to get to their destinations, they need to get to work, they need to provide for their families. So if they're put in a corner, are we not almost foreseeing outrage, some sort of protest here from those directly affected?
Absolutely. The government are looking for ways to increase. We're only at just over 50% vaccination rate. We need that to get up. Most Western countries are up around 90%, 90% plus, and we really need to get ourselves into that kind of position. So government and people like Professor Karim are looking for ways to get people to vaccinate, to overcome the horrendous misinformation and disinformation that people are going through. That's pushing them to not get vaccinated. But if we end up in a situation where the poor are being issued what is ultimately a vaccine mandate, whereas the wealthy are not, as I said, that's seriously ethically problematic. And we are bound to see, I would imagine, some form of protests and disruption that could be problematic in other ways.
What do you think then is a better way to, perhaps, I don't know if the convince is the right word to use, but to communicate and also share the benefits of vaccinations to those using, public transport so that they can consider it? As you mentioned, you believe that it is absolutely a responsible thing to do. It is absolutely safe. I think there's still a bit of hesitancy, hence we're seeing with the low numbers or just a direct choice to not vaccinate. But how do you think government can better position themselves so that the message comes across and is well received?
I think getting the information out there as to what the vaccine actually does is very important. Now, a lot of people will take the vaccine and then get COVID-19 and conclude that the vaccine doesn't work.
Right.
That just simply isn't the case, right? You might get COVID-19, but it significantly reduces your chances of transmitting the virus to more people. It significantly reduces the chances of you suffering severe symptoms, and it significantly reduces the chances of you dying and filling up hospitals. These are all really important things. And again, you know, the safety of the vaccine is brought into question, but by any reasonable standards of a vaccine, all the COVID-19 vaccines that have been approved are perfectly safe. You know, you are far more likely to get into serious trouble by getting in your car or getting into public transport and traveling to work in the morning. These vaccines are safe, and that message really needs to get out there. And of course, you know, that there's a large amount, as I said, of misinformation and disinformation. I believe the government needs to crack down extremely hard, isolate those tweets and those messages on social media and everywhere it comes up, and prosecute those people that are creating these false memes and all of this very, very dangerous information that's getting out there. And it's just lies.
And unfortunately, it is dangerous lies, putting many people's lives at risk. But Prof, I appreciate you speaking to us about this very morning. Professor Benjamin Smart joining us, talking about, of course, a proposed mandatory vaccination requirement for public transport. Perhaps you can even share with us what your views are on this by simply tagging us on Twitter at eNCA.